The purpose of today's video is to demonstrate a technique for nanofracture to improve on the theoretic healing of rotator cuff repairs. The idea being is to create bone vents into the cortex of the footprint of the rotator cuff to allow for bleeding and marrow potential to aid in the tendon bone healing complex. If there's concern for biceps pathology as well, at this stage I'll then proceed to my standard suprapectoral biceps tenodesis technique, which is to decompress the sheath above the pec major tendon, find the biceps tendon, and then do what I refer to as an in situ tenodesis. All right, so at this point now, what we've done is we've gone ahead and released the cross fibers over top of the biceps tendon sheath just above the pec major tendon. So here's the rotator cuff interval as we're looking here, and here's our biceps tendon. I'm going to transfer this up for a little better view now from the side. And you can see here quite clearly there's our biceps tendon running down into its groove. And we've released the sheath all the way down to the pec major tendon, which I believe is one of the big reasons that patients have significant biceps tendon pain, is because of the sheath pain. And the beauty of the suprapectoral biceps tenodesis is that by releasing this, we can do this in an arthroscopic fashion. So in particular, what we've been doing now is using the arthrosurface nanofracture technique to create some bone vents to try and get, again, a nice bony bed for which this biceps tendon is going to heal down into the bone. Okay, mallet, please. Coming down, there you go, good. Okay, so here we are now. I'm going to use the guitar pick technique here to back out the actual needle itself. And I'm just going to advance down into the bed here a little bit. I'm going to just push down. Again, I'm right into the sulcus of where the biceps tendon is. And we're just creating a few of these bone vents to try and stimulate some good bony bed for this tendon tenodesis to take place. Okay. So again, what we're going to do here is create a couple of just a small bone vents in here to hopefully stimulate some bleeding. So this is a technique. Basically what we're doing is creating a couple of small vent holes here to stimulate the bone tendon healing for the tenodesis. And now we're going to go ahead and proceed with our tenodesis with an in situ trans tendon approach.